Today, we're going to talk about People's Vaccine Alliance and the whole engagement around COVID-19. So by way of introduction, I would say that the status quo as it is, I'll start with a quote from Tim Fish-Hudson, ICJ's legal advisor. He said, COVID-19 is a global pandemic, but its impact was aggravated in Southern Africa by the failure of governments to prepare and respond individually or through SADC. That's what he said. And combating the deadly communicable disease like COVID-19 is one of the founding objectives under SADC's founding treaty, and is also accounted for under the SADC Health Protocol. So it's like what we are discussing is aligned to what is perhaps in the RISDP under the Health Protocol. So across the continent, we have seen cases rising at a faster rate compared to the other waves and expected to surpass the peak of the second wave recorded in January. The third wave is picking up speed, spreading faster, hitting harder, with the rapid rise in case numbers and increasing reports of serious illness. The latest surge threatens to be Africa's worst yet, says Masidou Moeti, WHO head of Africa. So as of 20th of June, which is the new wave, Africa had recorded around 474,000 new cases, a figure 21% higher than the increase for the same period in the second wave. So the pandemic is raging around the world, even though a few countries, mostly the wealthiest, are now able to look beyond the worst of it. Most countries in Southern Africa remain unvaccinated, and in fact, we are looking at a new devastating wave of the illness. SADC should immediately improve efforts at collaboration and coordination to ensure compliance with their human rights obligations to provide everyone in the region with vaccine access as soon as possible. Hudson added. So this is another quote from Hudson. So, and increasingly, we have seen the impact of COVID on the slowdown of economic and social growth, increased debt burden on many African countries. It has also unveiled our weak policies and systems, including the poor and dilapidated infrastructure and healthcare systems. It has also increased incidents of violence against women and girls. We have seen increasingly interrupted education and learning for almost all the countries. Governance systems has also come under attack with increased crackdown on dissent and mass protests. Corruption, accountability, and transparency as COVID funds are misused, mismanaged, and siphoned for personal use. So all these are of interest to us. We want to see what we can do to be able to salvage the situation. So this session objective is therefore to interrogate government's response to the pandemic, especially the vaccine access, to provide for clear recommendation on what SADC should do, especially in the implementation of RISDP, to raise awareness on the trends and efforts of civil society organizations, especially People's Vaccine Alliance in Africa and beyond. And finally, to mobilize more civil societies to join the crusade for governments to provide equitable access to vaccines as rights of every citizen in SADC. So today, you will join me with colleagues from PVA, that is People's Vaccine Alliance, Maza Sion, and Job Okanda from Oxfam to discuss this interesting topic. So Job will be taking us through what are the opportunities for engagement, what are some of the issues that we are currently working on, and later on we will be joined by Maza, who is already in the house, to talk about what is PVA and what have they been doing, especially the Africa chapter where she coordinates. So ladies and gentlemen, without much ado, I would like to invite Joab to take on the key opportunities that we have, around the COVID-19 crusade, the fight against vaccine access, and all its ramifications and what is ongoing. Then we will have Maza join in. Later on, we'll have an open Q&A session where everybody will be given an opportunity. We want that to be very interactive so that we can have your ideas around what is happening in your countries, what is happening at your level, so that we can make it look better for us, especially Southern Africa. We have seen how the waves are hitting in Zambia, in Zimbabwe, in Namibia, in South Africa. All across, we are going back into lockdowns. So this is serious. Something needs to be done and done urgently. So on that note, I will pass on to Job to take us through some of the opportunities that we have for engagement. Thank you once again. Over to you, Job.
Thank you, Buba, and thanks all for pulling together this event. I'm happy to join this discussion. And I think Buba has highlighted very key things of how who is being impacted actually. It's turning out that actually COVID-19 is an inequality virus. And I think when Maza takes us through his presentation, I think it's important that she takes us through her presentation because it covers more of what Buba you want me to speak about. But maybe to frame it, just to provide a framing before Maza comes in, because I understand she'll speak more of what has been happening and what we can do together jointly at the national level, at the regional level, at the continental level, but also at the global level in pushing for a people's vaccine. Just to say that maybe a year ago, the key barrier to defeating this pandemic was actually science. And we are all asking ourselves whether will the world be able to produce a vaccine that will end this pandemic. But when you look at how, when you look at the state of play of things today, the key barrier to defeating the COVID-19 pandemic is actually inequality. And since Buba, you started by quoting a couple of people, allow me to just quote what Strive Masiwa said on an interview on CNBC last week on Wednesday. He said that it's not a question of if this was a moral failure. He said that it was deliberate. Those with the resources pushed their way to the front of the queue and took control of their production assets. That's what Strive Masiwa actually said last week, because he's a special AU envoy on vaccines acquisition. When you actually look at who has been most affected by the pandemic, it is those with the least ability to cope. Those who cannot study online are those with the resources, without resources to actually enable their children to study. Those experiencing gender-based violence, in their homes are women and girls who are in a lesser position. Those who are not able to social distance are those in crowded slums in majority of our country. So COVID-19 virus has actually turned out to be an inequality virus. Those who are not able to access proper healthcare are those without the resources.
Salome, can you mute your mic if you are not this? Salome.
Oh, sorry.
Job, you are muted. Job, you are muted.
Sorry. I'm just saying that this is also playing out on how the world is responding to the pandemic. Those with the rich, those with the resources are able to procure vaccines and even vaccinate those who are not vulnerable. while those without resources are not even able to vaccinate their frontline workers. And all of us were depending on the COVAX facility, which we hoped that it will actually deliver 700 million doses. But this is not going to be the case, because at least 9 in 10 people in poor countries, particularly in Africa, are going to go without a vaccine. And the best that we'll be able to vaccinate our people is in 2024. And therefore, this is the reason why we all have to come together and push for a people's vaccine, a patent-free vaccine that is available for all, everywhere, despite your social status. It must be free for all. And that vaccine that is free for all, it must be safe and effective. And that's what the People's Vaccine Alliance has been pushing for. The inequalities within in COVID-19 vaccine is being presented in different ways. We've seen that when we are pushing for patent-free vaccines, we've had that, or we've had this narrative that that Africa, for example, cannot produce vaccines. And we actually know that we have countries such as South Africa, Morocco, that can actually produce these vaccines when the technology is shared and the vaccines become patent-free. And therefore, we are also seeing a narrative being created that actually it's only white people, white male people, or white rich people who can produce safe and effective vaccines. We've seen how that is playing out with the vaccines produced by Russia and China. And therefore, we're continuing to see inequalities in even when you say you produce a safe and effective vaccine, it's not, or it's rather taking long to be approved by WHO. And therefore, we also need to look at how do we actually decolonize the global health system so that we create a level playing field. When we say that we have produced a vaccine in Mauritius, for example, it's able to be looked at as a vaccine that it has been produced in the US, for example, or in Europe. We've seen how the European Union is behaving on vaccine passes. You know, the Covishield that has been produced by the Serum Institute of India, which was actually to be the one to be supplied by COVAX, has been excluded in what they're calling the European pass. So you cannot travel if you have a Covishield certificate. So that's how inequality is playing out within this pandemic. And we know as Africans, the worst is still ahead of us. We don't know how many of us have to die before pharmaceutical companies or the world makes the COVID-19 vaccines patent-free. We know South Africa and India put forward a proposal to suspend all patents at WTO. But we're seeing rich nations actually, such as Germany, opposing the proposal to suspend. So it seems like we're leaving the decision on who dies and who survives to the big pharmaceutical, to the big pharma. So it's important that we all come together as African civil society organizations, as African leaders, and interrogate ourselves. I was happy when Museveni was speaking at the WHO regional meetings, and he said that he wondered why as a continent, and I was so surprised that he was speaking as if he's not been in a leadership position on this continent, why we are not able to produce vaccines. And he also said of the lessons that we've learned about who is our enemy, you know. So he said that as much as we are able to die, our children will know who our enemies are. We should not wait to die. We should confront the problem as it comes. I'll end here, Buba, and wait for an interactive session after Maza's presentation. Thanks, Buba.
Thank you, Job. Thank you, Job. You realize that what he's trying to point to is that COVID-19 and the fight around it is all around inequality, the injustice that surrounds it, how the wealthiest are able to vaccinate their people, even those that are not vulnerable, when we are not even able to go that much. And we have the resources, we have what it takes, but the inequality and the injustice systems that have been set across the world impeding, and partly also because our leadership challenges. So where do we go from here? So on that note, thank you, Job. Thank you, everyone. I would now invite Maza Sion, the PVA Africa coordinator, to take us through what PVA is, what are the excellent things that they are doing, and how can we all join the crusade to be able to ensure that vaccine access and vaccine equity becomes the thing of the past. Thank you, Maza. Welcome, and you have the floor.
Hi, everyone. Thank you, Buba. Thank you, Joab. I'm happy to be here. I'm sorry I missed yesterday's session, but I look forward to the interactive discussion today to learn from what you all discussed yesterday and to move forward as a group in this fight for a people's vaccine. Buba and Joab have really laid the groundwork very well for what I'm about to talk about. And then, as Buba has pointed out, we are really hoping for an interactive discussion that will help us as we plot the way forward. I am going to try to share my screen. Can people see the presentation? Buba, is that visible?
Yeah, it's visible, yes.
Okay, great. Hold on one second. I see that I am not at the beginning. Great. Okay, so as Buba and Joab have pointed out, my name is Maaza Siyum. I'm actually with an organization called the African Alliance, and the African Alliance is the Africa chair for the People's Vaccine Alliance. For those of you who have been with us in previous meetings, I hope you will forgive me. Some of these slides will be a repeat, but if you've heard this before, hopefully you are then prepared to ask questions and participate in the follow-up discussion. So for those who are not familiar with the People's Vaccine Alliance, what is it? It is not an organization. It is a coalition of organizations and activists united under a common aim of campaigning for, as Joab said, a people's vaccine for COVID-19. This would be a vaccine based on shared knowledge and, most importantly, freely available to everyone everywhere, a global common good. At the moment, there are about 55 organizations, including Oxfam, African Alliance, and ActionAid in the People's Vaccine Alliance, organizations from all over the world, as well as world leaders, health experts, faith leaders, economists. So people sign up either as organizations or as individuals as well. So as we talked about, the People's Vaccine Alliance is calling for a vaccine that's free of charge for everyone, everywhere, distributed according to need with no exceptions. We're advocating for open sharing of vaccine science, technology, and know-how. Here, advocating for the use of CTAP. For people who are not aware of CTAP, it is the COVID-19 Technology Access Pool, launched by WHO in partnership with the government of Costa Rica and 40 member states. It's intended to provide a means to accelerate the development of products needed to fight COVID-19 and to scale up manufacturing. The hope initially with CTAP was that pharmaceutical companies would willingly hand over their know-how and IP for manufacturing to be rolled out. That has not happened yet. Not one pharmaceutical company working on COVID-19 vaccines has
Existe
joined.
companhia que está a trabalhar para a fabricação de vacina de COVID-19.
I hear Portuguese. I hear Portuguese. Have I accidentally clicked on something? I'm hearing the Portuguese translation. Is that?
I think it's a translation facility for colleagues who are Portuguese. So maybe it's happened by mistake.
Okay.
Yeah.
Okay. So just to go back to the slide, so as I was saying,
Voltando à página,
not one pharmaceutical company developing COVID-19 vaccines has,
existe
as
uma
of yet,
companhia que está neste momento a fabricar as vacinas de Covid.
just to the Portuguese translator,
Julie,
I'm
is
so
that
sorry.
the way
Should we be
English
hearing the
goes?
Portuguese feedback?
Hello? Are you still hearing me?
Yes,
We're
I'm
hearing
still
you,
hearing
but-
you.
We will have to assign you. Sorry, you joined late. Assigning you now.
Oh, okay.
Okay,
They are moving him into.
Yes.
okay,
All those in
thank
favor?
you. Thank you. I'm sure he's perfect for the Portuguese speakers, but it's quite difficult when I hear him in the background, and maybe for the others as well. Okay, so one of the other goals is also the global manufacturing and distribution plan for cost price vaccines, and also investment in production capacity and health workers as well, and other things that are needed in the fight against COVID-19. Joab, I think, briefly mentioned the TRIPS waiver. I think many of us have heard about the TRIPS waiver. It's the trade-related aspects of intellectual property rights. That is what TRIPS stands for. This is the World Trade Organization agreement, the TRIPS waiver. It's the most comprehensive multilateral agreement on intellectual property. And this is the waiver that would allow for IP rights for COVID-19 vaccines to be temporarily waived in order for vaccines to be manufactured around the world. As many of you know, in October 2020, South Africa and India submitted a proposal at the World Trade Organization to temporarily waive certain IP rights under the TRIPS agreement until widespread vaccination is in place globally. Since then, despite really high level and very aggressive advocacy, many countries are still blocking the TRIPS waiver, notably most of the EU and its member states, the United Kingdom, Norway, and Japan. The US, as many of us have heard in April, decided to support the TRIPS waiver. That was a huge win, partially due to the advocacy of the People's Vaccine Alliance and others. France has very recently changed their mind and agreed to support the TRIPS waiver. But as you can see from this map, and I'm sorry, it's a bit, there are lots of different markings on it, but you'll see the orange, the yellow stars are the sponsors and co-sponsors of the waiver. Then you'll see the green ticks are supporters of the TRIPS waiver. And then position undetermined, Canada, surprisingly, is still wavering. So that is a country that is being worked on. And then opponents, most of the European Union, as Joab and Buba mentioned, Germany is a very staunch opponent to the TRIPS waiver. So that just gives you a state of where we are with that. And working on the TRIPS waiver is one of the areas that the People's Vaccine Alliance is also focused on. So who is the People's Vaccine Alliance trying to influence? Number one, rich country governments to demand that they do everything in their power to pressure pharmaceutical companies to share the science and technology and enable the World Trade Organization's TRIPS waiver process. Pharmaceutical companies themselves to pressure them to share the science and technology and stop putting profits before people's lives. One piece of data that the People's Vaccine Alliance has compiled in the last few months is the fact that there are 9 CEOs of pharmaceutical companies that have become billionaires in the last year on the backs of lives that have been lost and on the sale of COVID-19 vaccines. So pharmaceutical companies are a group that obviously we are trying to influence. Low and middle income countries, there are still some wavering in their support of the TRIPS waiver. We are trying to encourage all of them, all of our leaders to raise their voices more assertively, trying to influence the public and also the media, trying to change the narrative. And we have seen that in the last few months, things like IP rights, TRIPS waiver are really sort of frequently seen in media all over the world, not just in the US and in Western Europe, but also in African media. The plan for influence is mass public pressure, especially in the rich countries, mass media attention, targeted advocacy and integration of priorities from the Global South. So the People's Vaccine Alliance has really made an effort to include representation from Africa, Asia, and Latin America in the same way that we have a People's Vaccine Alliance coalition in Africa. There's one in Asia and Latin America and the Caribbean. Something to point out is obviously that everything changes very quickly. So we do, it is sort of like building the ship as you are sailing it. The Alliance does try to be flexible and responsive to things as they go along. There is a global petition, and that is part of the public's sort of advocacy and push. At the moment, close to 3 million people have signed the petition. This petition was delivered to President Macron just a few days before he agreed to finally change his mind and support the TRIPS waiver. This presentation will be shared, Buba, I think, with everyone. So if people would like to go to the links and see these, the petition and other links included in this presentation, you'll be able to do that. These are some of the activities that were put forth by the People's Vaccine Alliance over the last few months: protests, sort of media actions. This here, Drop the Patents and Vaccine Apartheid, was in front of a pharmaceutical company, I believe in London. Here's also the giant People's Vaccine, not-profit vaccine banner dropped in London in a central place as well. There has been, as I said, lots of pushes in the media. Here we have Pope Francis and other faith leaders supporting the waiving of patents on COVID-19. Here we have Meghan Markle and her husband, as I like to say, also providing support for the waiving of patents and sharing of vaccines. The People's Vaccine Alliance has done a very good job of using social media, developing statistics, and kind of developing graphics related to these statistics. So here, Greta Thunberg, in the kind of push to influence people in the global north, that's a person who many people know, the environmental activist. This is showing how old she would be before the world's poorest are vaccinated. So data has shown that it would take 57 years in order to reach herd immunity in the world's poorest countries. So that's just sort of images that kind of go to those things. There have been animations developed, videos developed. Here's one that was developed by the African Alliance, just showing the leaders stopping progress and going for profits rather than people's lives. In terms of op-eds and letters, there have been lots. There's an influentials team in the People's Vaccine Alliance that really pushes to get influential voices behind this fight for equity. So for example, here, I hope the link goes through, but you will see that there was an op-ed penned by the Archbishop of Cape Town that was in the Daily Maverick in South Africa, but then also translated into Norwegian and put in a Norwegian newspaper to try and influence there as well. Here we have a letter to selected European leaders signed by African civil society members. I think some of the people in this group signed, and this was a letter in the lead up to the Group of Seven meeting where we were encouraging the former colonial powers to recognize the fact that some of their behaviors were really quite colonial in nature at the moment. Here we had President Macron of France, who had just been in South Africa maybe 2 weeks before, saying that, he was a friend of Africa. And, now at that point, still blocking the TRIPS waiver. He has since changed his mind, and we will be removing him from this letter and hopefully having this letter be adapted and published in UK newspapers as well. So this is the kind of advocacy that we try and push forward. So the current state of play is, as Joab and Buba have already mentioned, 9 in 10 people in the majority of low and middle income countries are set to miss out on vaccines this year. COVAX has been a huge disappointment, and I believe people have already discussed COVAX, but it is an initiative led by Gavi, the Global Alliance for Vaccines and Immunizations, and CEPI, the Coalition for Epidemic Preparedness Innovations, and the World Health Organization. And this was a pooling mechanism to try and get vaccines that were donated mostly from rich countries to reach low and middle income countries. This has not worked. Even if it did work, the coverage would only be 20% at best. And lots of the rich countries, as we have heard, have been hoarding vaccines. So even the committed donations have not been provided. So what this has meant is that low and middle income countries have been left to bid in the open market, sometimes paying even higher prices than the rich countries. So the rich countries have 3 times more vaccines than they need. They've bought up the vast majority of the supply. There are supply delays. Pharmaceutical companies are really defending their monopolies. And there's lots of discussion about charitable donations, which gives the rich countries a lot of press, but has not resulted in any actual change for African countries. So here is a map that was pulled together by Oxfam colleagues that have consolidated data. This is just to show you doses secured to fully vaccinate populations. So the green are the countries that are doing quite well. The red are the countries that are really struggling. And then you have the countries in between. And as I said, these slides will be shared so people can have a look. Here, I'm sorry that it's quite small, but this is data from about a week ago. For every dose given in a low-income country, 121 are given in a high-income country. And here you see that Africa, in terms of percentage of people vaccinated, is the continent that's struggling the most. Joab has already touched on these issues. Here, wanted to talk about donations, donations promised. Here you have the US is yellow. President Biden received a lot of press around his commitment to doses that would be donated at the Group of 7 meeting. Even if all of those doses, the 500 million, were donated, that is still, as we know, maybe only 3-4 African countries at most that would be reached. But even with all the press that the US received in terms of donations delivered, you see here on this side, the US has committed to all of these, but only delivered this much. In terms of China, that is the country that has provided the most donations. In terms of upcoming strategic priorities for the People's Vaccine Alliance, really pushing the US to play now a diplomatic role, given that they have agreed to support the TRIPS waiver. Focus on tech transfer through CTAP, as I mentioned, is what would be the voluntary setting aside of IP rights by pharmaceutical companies that not even one has agreed to yet. And also pushing for progressive text at the World Trade Organization for a waiver. So that is one concern that advocates have, that even if the TRIPS waiver goes through, that it will be very watered down. Text-based negotiations have, in theory, started, and there is concern that the text of the waiver will be watered down and made very mild. So pushing for that. There really is a push to amplify stories and voices from the global South. So that would be Africa, Asia, Latin America, and the Caribbean, on the cost of inaction around COVID-19 and the readiness to manufacture. Joab touched on this. Much of the narrative has been the fact that even if the TRIPS waiver was put into effect, even if technology transfer started, that African countries and Asian countries, Latin American countries would not be able to produce vaccines. That is completely untrue. As Joab mentioned, there are African countries that have manufacturing capability. India has been a huge manufacturer of vaccines for many years. So there is a push to get those voices about the readiness of manufacture out. Pushing Germany. Germany is the most important blocker at the moment of the TRIPS waiver. So pushing Germany and the rest of the blockers to pursue this tech transfer and back the waiver. Increase the heat and I would say the shame, if they can be shamed, on pharmaceutical corporations, with the goal of at least one corporation joining CTAP this year. And then also consolidation of African data for advocacy purposes. Many of you have heard of the African Vaccine Delivery Alliance, which sits at the African Union and Africa CDC. They have a great database and dashboard where they share information. The World Health Organization, AFRO, also has a great database. And for our purposes, in order to conduct advocacy, as Buba mentioned, a lot of our work is facing toward the northern countries and pressuring them and the pharmaceutical companies, but we also need to pressure our own leaders and make sure that they are doing the work that needs to be done to make sure that the access is improved. So that's something that I think we really need to push on, is consolidating data for advocacy purposes. And I'm going to stop sharing my screen and talk a little bit about just the way that the People's Vaccine Alliance has been functioning in Africa. We do have a monthly meeting that we host, an informal meeting on the last Thursday of every month. And Buba, I hope you will facilitate this for people who would like to join those discussions. That is an opportunity for civil society organizations to gather and talk about issues of vaccine equity and vaccine access. We do at that meeting provide an update from the People's Vaccine Alliance Global's perspective in terms of what has been done in the last month and what advocacy opportunities are coming up for the next month. So for example, the Group of 7 meeting was on our agenda. There are other meetings that are coming up soon, the World Trade Organization meeting and other meetings coming up in the next few months. So that gives us an opportunity to brief our colleagues around the continent on those advocacy opportunities and also hear from them on what their concerns, priorities are, and feed that into the strategy of the People's Vaccine Alliance. We do have a WhatsApp group where we share information and are really trying to make sure that that is a mechanism that flows a little bit more easily, just so the concerns of colleagues and comrades around the continent are fed into the People's Vaccine Alliance, and also so we can support each other. You know, Buba, for example, shared about this meeting during our last session last week. There are many colleagues, whether in West Africa, North Africa, Southern Africa, East Africa, doing really interesting work, hosting webinars, doing activities on the ground where it is possible. So that really gives us an opportunity to coordinate and to support each other. So I'll leave it there for now. And I am, of course, Buba, happy to take questions and discuss. You know, I think our hope is for the interactive discussion, if there are already ideas and thoughts that we can take forward to our next Africa Civil Society meeting, or even to feed into the People's Vaccine Alliance, we would be very grateful for that. So thank you.
Thank you. Thank you so much, Maza. I think that was excellent. Great ideas coming from you guys, and the essence is to be able to team up to be able to get this off the ground and to ensure that we mobilize more civil society to go join the crusade. Well, thank you so much for that. Before I open up for Q&A, Job would want to come to briefly talk about what is happening at the national level in most African countries. Because we want to see the connection between what is happening at the regional level, continental, global, and the local and community level. So over to you, Joe, before we open up for Q&A.
No, thanks, Buba. No, just briefly, yeah, as much as we're pushing at the global level for patent-free vaccines, I think we also have responsibilities as Africans at the national level to ensure that actually our governments are prioritizing COVID-19 vaccines. For example, if our governments, for example, are doing their national budgets and they're not factoring in procurement of COVID-19 vaccines, then what does that tell us as African citizens? We should not be waiting for charity. We should have control of our fate, but by using the little resources that we have to actually ensure that we are also preparing to procure vaccines. And as civil society organizations, we have the opportunity to also push for transparency and accountability on how COVID-19 resources are being used at the national level. We should be able to demand how the loans that our government are taking, for example, how they're being used, who is it benefiting? The social safety nets that our governments are putting in place to cushion the most vulnerable. Are our governments or our leaders accountable to the plans that they put in place? The contracts that our governments are entering into with pharmaceutical companies, I think because they're using our taxes, it is important that we get to know the details of those contracts. How much are the vaccines being procured? Who is it being procured from? What is the shelf life of those vaccines? And if you notice that also the donations that we are receiving as a continent, we're receiving donations that are actually also about to expire, and therefore that comes with some logistical challenges, because if you receive a donation that is about to expire in a month's time, does it mean that the government will only prioritize the easy to reach populations. What happens to the rural population? Because sometimes it takes more than a month before the government delivers the vaccines to the rural area. So those are some of the things that I just wanted, as we discuss this, to also factor in.
Thank you. Thank you, Job. Thank you. Now we are at the stage where we'll open the floor for question and answers. So if you want to talk, raise your hand, and then I'll give you the floor to ask your question. And if you have also remarks or inputs that you want to make to this process, you can equally do that. I just want to reiterate the fact that there is, in Africa, we are in a difficult situation because we have seen also in very many places vaccines expiring, not because of logistical issues, but because people are hesitant to go for the jab. So how can we be able to turn that around? How can we bring in people's confidence to be able to go take the vaccine? So all these are part of the challenges that we are facing. But if more people get to understand what it takes to be able to do that, I think we will all be safe. No one is safe. Directly or indirectly, we are all impacted, we are all affected. So to be able to have a joint effort to be able to fight this pandemic. So I have Garikanai Shoko and then Maza. So Garikanai, you have the floor.
Okay, thanks, Buba. Good morning, maybe good afternoon to others. Thank you for the presentations, but I have quite a number of issues, input, and also questions. Number one, the issue of, okay, maybe let me introduce myself. My name is Garikanai Shoko. I work for a global trade union, the Building and Woodworkers International. I'm based in Johannesburg, South Africa. Thank you. The issue of vaccination, I think there's a lot of information, and because of a lack of transparency in terms of the information, there is a lot of hesitance for citizens to be vaccinated. For example, the big pharmaceuticals who are producing vaccines, they don't want to release the information. That is number one. There's information that in the event that you have got after effects, it's your responsibility. Number two, from history or from science, vaccines are produced after a long time. The process of producing vaccine, it's a complex process. Sometimes it lasts 10 years. But the question of how is it possible that we ended up with a lot of vaccines in a short period of time? And I think it's Joab who spoke about donations. These vaccines that are donated to African countries, I believe it's a clinical trial. They are not yet at their full state to say it's 100%. So they are doing clinical trials. But the question is, what are the effects? Maybe how long does the vaccine take in your body to be effective? And what are the effects? Maybe is it heart attack or any other diseases? Because this information is hidden. What will happen if the vaccine expires? You see, the whole speculation about the production of vaccine and the whole speculation about what are the effects of these vaccines, it gives hesitance to many citizens. Then in terms of procurement, I think our African governments, they are not committed. It's like they wait for donations from China, from Russia. They don't want to commit, like what Joab say, they don't put budgets. When they do the national budget, why don't they allocate funds to procure vaccines? Thank you.
Thank you. We have Maza, then Samwely. Maza, you have the floor.
Great. Thank you.
You can talk on the hesitancy, as you said.
Okay, thank you. And before that, though, I also wanted to say, and Buba, I hope you have everybody's email information from this session. I think it would be interesting for people to, we'll send the link for the African Vaccine Delivery Alliance. As many of you know, they received a very large commitment recently from the MasterCard Foundation. I think it was over $1 billion. And they have committed to developing what they are calling a solidarity package that will go to African countries, to address issues of access. So some of the things that Joab spoke about, are we only reaching people in the cities? Can we make sure that our access is rolled out also in rural areas and to hard to reach groups? And also tracking and trying to work on issues of hesitancy and confidence. I think all of this is still being developed. And I think for people in this group who are interested, civil society organizations or educational institutions, et cetera, it would be really good for you to join in these forums that are available with the African Vaccine Delivery Alliance. There is a, I think they're calling it a pillar that is the community engagement pillar, where many of these questions will be addressed. Joab quoted, Strive Masiwa from last week, the Zimbabwean business leader who is part of ABDA, and he had said that money is actually not the issue. The lack of vaccines is the issue, which is, I think, why we feel the need to do so much of the advocacy at the global level. There's simply not enough vaccine to go around at the moment. But I think everyone here is absolutely right that we also need to pressure our leaders and support them as well. So I want to speak to our comrade Garikanai's comments and questions about the vaccines. Before I started working on COVID-19, I used to work on HIV prevention research. And I know for people who work on HIV prevention and vaccine research generally, it is so amazing to see how quickly the COVID-19 vaccines were developed. And something that we have seen and researchers have actually said is that the amount of competition for funding for research usually is enormous. How you have scientists like hiding data from each other, trying to make sure they get to the funder first. In this case, because it was a pandemic that was affecting the whole globe, there were actually no issues with funding for vaccine development. It was the first time that everybody worked together. Countries put in billions of dollars to develop these vaccines. And this is something that in the past, researchers would be fundraising, pharmaceutical companies would be trying to get money in order to do the research. So I hear, I know, and I've heard what Garikanai has said from other people as well. Why is it that we have been waiting? We've been waiting 30 years for an HIV vaccine, and we have a COVID-19 vaccine in a year. That is because of the level of resources. I mean, this is very much a lesson learned for other work, is that if the resources are available and the competition is put down, so scientists don't need to stab each other in the back and hide data and rush to reach the funder, that things can be done. Obviously, the COVID-19 virus and the HIV virus are different. I'm not saying that, that we'll have an HIV vaccine, next year if we have funding, but that's just Garikanai an important, and for others who are skeptical about the speed, something to keep in mind that people really worked together in a way that all scientists have said they have never seen before. And the funding came from public funding, which is another reason why the pharmaceutical companies should be ashamed of themselves that they are not providing these vaccines at cost, because they did not fund the development of these vaccines for the most part themselves. They were funded by state money. In terms of, whether the vaccines are safe, Garikanai, I can assure you that, this was another thing that was done differently from other research, is that rather than doing the first phase of the trial, then doing the second phase, then talking and doing the third phase, a lot of the work was done very quickly because of the global pandemic. So obviously no vaccine, no medication that we take is 100% safe, but the trials have been done to the same ethical standards that, whether we take high blood pressure medication, we take ARVs, we take oral contraceptives, everything that we take has been done by the same type of clinical trials. So I think the question of the expiration, that I do not have data on, and that is something that is, a concern if people are being given vaccines that are are close to expire, I think the main concern there would be, will they still be effective and for how long? And I think in terms of the length of effectiveness, given that this is a new disease, new vaccines, that's something that a lot of people are telling us we are not sure about, especially with the variants that are developing. I think everybody here has heard about the different variants. You know, this is what viruses do, is they mutate. You know, they try and mutate in order to escape, you know, vaccines or medication. So with the new variants that are coming up, it is not entirely clear how long the vaccines will be available. So I think, Garikanai, your questions are, you are not alone. Many people have asked these questions, but in terms of the research and the length of the research, which is something that comes up over and over, I just want to reiterate that this research for COVID-19 vaccines was done in a way that no other research has been done in the past in terms of the resources pushed in and the level of collaboration. Thank you, Buba.
Thank you, Maza. That was excellent. I think with technology, with science improving, and with more resources, we could do it. And that's how it's that fast to be able to get the vaccines. We have Samwely on the line.
Yes, sorry, my name's Samwely Mkwatwa, and I'm talking from Action Aid Tanzania, and also the PSA project manager for the case of Tanzania. Thank you, Maza, and the other colleagues who have just presented. You know, some of my questions, of course, have been like kind of answered. Because for me, I was just looking on the conspiracy and some of the rumors that are going through towards this, you know, COVID-19 vaccine. You know, so some of us, some of our people are much working on what they hear much, you know, and the science behind it has not been that much good. I mean, awareness. You know, we see that the government or other countries, especially for us as a Tanzanian, you know, that kind of education or that kind of awareness towards the vaccine is not that much spread. So we just hear say, one of them, for example, we have some nearby countries, and there have been this kind of, you know, rumors in the social media that sometimes, you know, some of the government are manipulating the data. You know, they are saying we are infected, they are infected, you know, they just manipulate the numbers so that the problem is not like what it seemed to be. You know, there was a case of one country, nearby country, seemed to say people are just, you know, going there to bury just an empty coffins just to make people believe that this is an issue of the COVID-19, why not? So now I was just wondering, how is it that we can make one to believe that these vaccines are real? Because one of the challenge, like what my colleagues are saying, is about believing. Like when we take this kind of vaccine, how effective is that vaccine and what will be the side effect of it? So there have been these kind of rumors that when you take it after 2 years or what, you know, they sue it with the other, you know, kind of conspiracy going around that, you know, there might be a problem. One issue is like that one in saying, you know, while we are struggling for other vaccines for many years, why COVID-19 is taking just 1 year to have this vaccine in place, of which, of course, you have said. So what I'm looking here is much of the awareness. What if as Action Aid or other, you know, INGOs, what are we doing, you know, pushing our governments to give what is supposed to be given? I mean, to raise awareness to people so that they can understand that these vaccines are good. And some of them, they say, oh, some people are getting this vaccine, but when they go to other variants of COVID-19, they get infected and they die, you know. So what, for me, my question or my contribution, what I can say is like, how are we going to make sure that the issue, what I say, the information, the right information of COVID-19, especially for our case in Africa and particularly in my country, how can we make sure that people believe, you know, in the science, you know, like what you said, the Mazi said about the science around it. How can it now? People should know, like what now? We don't see many of the advertisements going on in TVs talking like what have been in HIV and some other pandemics, that this is what is happening. The COVID-19 is like this, the vaccine is like this, you know, so that people can understand all the issues around the vaccine. So for me, I think that is what is important, and that is what we can push, whether from the government to make sure that information is available, people can access this information, so that before we go to that mass taking, because you can say, okay, it should be free to everybody, but when it is free, people don't go to take it because they have some rumors, you know, religious people, what are they saying? Because even in our parliament have been like a mixed kind of belief towards it. Some members of parliament, they are advocating for taking a vaccine. Some of them do not even say that. They say, no, that is not a good thing, you should not take it because it has one ABCD. So I think this, the information around COVID-19 vaccine should be well, prepared, and maybe the government in the SADC should make sure that people get the right information towards that. Because if they don't get the right information, even if we say that the vaccine can be free, nobody will dare go and take it. We have seen in many other vaccines that were being given, even to our children. Some people say, no, don't take that vaccine because it has 1, 2, 3 to your child. So people just don't send their children to vaccine. So as much as we want it to be free, but we should go with the campaign to make sure that the right information for COVID-19 vaccine is just spread out. So that was my contribution. Thank you.
Thank you so much, Samwely. Information is power, and right information is more important than anything. So we need to be able to invest in raising awareness and getting the information out there. And colleagues, as we ask the questions, we should also factor in what recommendation we will want to give to SADC, since this is a space where the RISDP implementation is being discussed. Let's factor in what is missing within the SADC. Glenn, I have seen you added a lot of information on what is happening around the SADC. If you would not mind to share some of your ideas around what could be done and how can we mobilize civil society to be able to work together in this crusade, I think that would be essential. So your experience and outreach is quite wide. So please, share with us and give recommendations where necessary. Thank you.
Thanks, Buba, and to the organizers and panelists. I think it's been an eye-opening session. I do think that it points to a serious lack of community-based information, and I think the failures of our member states and intergovernmental organizations such as SADC at this critical time. I think for most of us, it's been an incredible evidence of the failure of regional integration. If we ever wanted a case study in terms of how SADC does not work, I think COVID-19 is really everything in a microcosm. And I think this should alarm us, because in this space, we are attempting to construct effective platforms, both in terms of content, processes, and institutions, to enable us to achieve the goals set out in the Regional Indicative Strategic Development Plan. So there is, I think, the first level of activity for us is to perhaps draw lessons and learnings from what has happened. So I want to, some of the information I've shared is simply historical for background purposes. And I think it must help us track where and how the process is broken down. So not to be overly sort of historical, but if we look at the health protocol, which was adopted by SADC back in 1999, and then a plethora of related initiatives and instruments which have been signed onto by member states, when tested against the reality of this particular pandemic. And I think much of the challenges were already lodged I think the Maza was speaking to this. We can find the contradictions, the challenges, and the blockages already present in our response to HIV/AIDS as a pandemic and TB and malaria. So these institutional blockages have been exposed. I think SADC's inability to really coordinate a response resulted in incredible unevennesses in the region. And this, of course, pertains particularly to vaccine procurement. So member states in their hour of need did not pool resources, did not share expertise, did not facilitate a harmonized response, but rather sought to address this crisis at a national level. So we had hugely varied extremes, from the United Republic of Tanzania taking a particular stance up till very recently, to other countries imposing significant single instrument responses, namely lockdowns and states of emergency, to some of our island member states really getting ahead, like the Seychelles, in respect of vaccinations and public awareness, working with non-state actors quite proactively. So I think there's been an extensive mix, but I think we need to locate, for me, I don't think I have any particular answers at this point or things that could be useful, but I do think that we need to interrogate now as civil society, and let me say progressive civil society, what our role can and should be. I think, of course, that the context of COVID-19 has also disrupted our ability to articulate the on-the-ground experiences. But despite that, I think many organizations have been able to document, to monitor, and to begin to shape policy alternative responses. So I think in the first instances, the approach we need to take must be far-reaching, systemic, and all-inclusive. That is to say that our approach must not be to treat this as a single event pandemic. It must be to locate the principles and the mechanisms for investing in public health, and the entire value chain that is required there, which I think the high end of that value chain is vaccine production, distribution, but it also must include our understanding of how we reinvest in primary healthcare, in community surveillance of pandemics and public health crises, the infrastructure that is required around rebuilding our health systems. And I think fundamentally in the context of the RISDP, how do we prioritize the resource allocation? So we understand the global vaccine inequality. We understand the global apartheid, if you like, when it comes to vaccinations, the technology, the TRIPS, and the intellectual property challenges. But it is incumbent on us to recognize that we have had a lead in time to this particular pandemic of some 20 odd years, in which we had already identified the dangers of communicable diseases and the necessity to put the facilities in place and the requirement for us to pool our resources as member states within SADC. So, Buba, I think I don't think I'm being helpful in this conversation, but I think that we need to, coming out of our conversation here, begin to consolidate and cohere an effective intervention strategy, because as much as these vaccines may be effective, and I just want to make a side note that I think that there is really been a significant failure on the part of government communication, and I think this extends then to SADC and the AU CDC, to simply explain what viruses are, let alone what vaccines are. So the disinformation arises out of a communication vacuum, and that creates fear and hesitancy. So recognizing that, we need to offer our services here to be effective communicators to communities. But having said that, we also have to now insist, as I think Maza has explained, on complete transparency in the processes that are occurring, and we need to align with the Vaccine Alliance to mobilize for that. In addition to us articulating the demands for reinvestment in public health and the rebuilding of that. And I think in the context of RISDP, it's getting down to the nuts and bolts with the Council of Ministers and the SADC heads of state about how they are actually going to achieve this, how they are going to reinvest, and how they are going to mobilize the resources in a shared pool to ensure that no single country is left behind and that no single person in our countries is left behind or excluded from what is required now, which is a massive reinvestment in public health. So I think those are, for me, the challenges and the opportunities that we are presented with.
Thank you. Thank you, Glenn. This is excellent analysis of the situation and very good recommendations to take forward also. I'll have three more hands, so I'll go with Tumiso and Lungu, then Joab and Maza in that order. So we have about 20 more minutes to wrap up. So before then, let's have these colleagues. Over to you, Chipapi Tumiso.
Thank you very much, Buba. I hope you can hear me.
Yes, we can hear you.
All right. So my name is Tumiso, and I'm just an independent consultant, still in the youth space, very much active. I think some of the discussions that I've been privy to around youth has really been that what is this ambition that we have that suddenly everybody is now going to care about what happens to Africa, what happens to the poor. I mean, people have been poor all this time. We've seen development has been unequal. We've seen all this. So the questions that they're having is that what would make COVID different? Yes, there's struggles. Yes, they see people dying. Yes, there might be few, but we've seen how it has always been the case that development will go to certain countries, and then certain countries have to give up certain things for certain development to actually take place in certain countries. So I think that's the first question that I have is, but what makes this different? Yes, there's people dying, but they've been dying all this time. So what is it that we think that suddenly because of COVID, everybody's now going to come together and work together and we're going to solve this global crisis? So that's the first question. The other one is really about, even if we were to make the process of vaccination open to countries and for countries to try and do it themselves. I mean, we look at right now, governments are spending money from the disaster management funds on themselves. And imagine if now we have a situation where we have people, countries being able to produce themselves, and what would possibly come out of that? So there's just some of those questions, just to be short. Thank you.
Thank you, Tumiso. Excellent questions. I think this is unveiling the deep-rootedness of inequality, but why now? Very pertinent question. I'll go to Lungu, to Kozile, and before Joab. So please, you have the floor.
I hope you can hear me. Am I clear?
Yes, we can hear you.
All right. My concern is on the information that people are getting out in terms of COVID-19 and its vaccine. As SADC and as countries in the SADC, I think we need to approach information dissemination quite differently. Because if if local people do not trust what the government is telling them, then we have to include their local members that they trust, train them in the way that they'll give out this information to the people so that we don't have this gap between people that have the correct information and those that don't have. Because this then is also a barrier to actually dealing with COVID-19, because in as much as we might have resources, we might source those resources and the vaccine might be in the country, but then if the people have the wrong information about the vaccine, the wrong information about COVID-19, we'll see that all this effort will bear for this effort will not yield anything. So I think as countries, we need to approach information giving out quite differently. We need to involve these local people. We need to involve these people that do not have access to social media or any other platform that give them actually correct information, because at the end of the day, most of these local people are the ones in the majority in most countries. So as the vaccines are coming in, I think it is also good for countries to involve these local people so that when we look at the coverage of those people vaccinated in these rural areas, then it wouldn't be as burdening as it is right now. Thank you.
Thank you, Lungu. That's very important. About trust between government, citizens, and what is being open and transparent, so that we can together, tackle this situation. I have Job's hand and then Maza as we wrap up.
Thanks, Buba. I think just to start from where Glenn said, we really need to look at how do we strengthen public health systems on the continent. And therefore, we should actually, as much as we're focusing on COVID-19 vaccines now, COVID-19 is not going to be the last pandemic to hit the continent. We should have learned from the HIV, from Ebola, to strengthen actually our public health systems. The other thing I wanted to say is that when we talk about Africa's development, we're just witnessing a situation where, as the developed countries' economies are opening up, people are starting to move. Our countries are going into more and more serious lockdown. So that should actually tell us that without the vaccines, our economies will continue to be in lockdowns, and it's us African people who will continue to suffer. We know our leaders have failed us. The commitments they've made at the continental level, for example, to invest 15% of the national budget into public health care. No country is even near to that. And we should start reminding ourselves and our leaders that these are the commitments we had made. If we had actually stayed true to those commitments, 19 years later, COVID-19 would not have found us where we are. We've seen some countries that, we have countries that had, when COVID-19 hit, some countries had more vice presidents than the number of ventilators in the entire country. So that should actually tell us how much our leaders, how much our governance systems have failed us. In terms of awareness, I really hope, and I think we can also play a role to push governments to invest the same way it invested in creating awareness, in asking people to wash their hands, in asking people to social distance. We should see the same energy when it comes to vaccinations. The governments should invest in building awareness, creating awareness on the vaccines. And I think Maza can speak to this, trying to put together some information around the vaccines and also to dispel the issue of vaccine hesitancy. And to be honest, vaccine hesitancy is not only to COVID-19 vaccines, it's to all vaccines. When you look at vaccine hesitancy in the continent, it's not just this time, it has been there before. So how do we ensure that our communities, our people get vaccinated when vaccines are available. And actually, there is a recommendation by WHO on the overall COVID-19 budget. There is a percentage, I think it's 2% of the budget, if I'm not wrong, should actually go into creating awareness on COVID-19 vaccines, but that's not happening. And we should link government responses, our inability to respond adequately to the structural injustices that the continent faces, to the systemic issues that the continent faces. We are perpetuating a narrative where it's only charity that can save us, as our governments don't prioritize, and therefore we don't have. We're waiting for fate. We don't have control of our own fate. That's what all this tells us. So for me, I think we can play a role in creating awareness around vaccines, also knowing that without achieving that herd immunity, we'll continue being in lockdowns. Our children will continue being out of school, will continue experiencing gender-based violence and all the risks that have come with the COVID-19. Thank you, Buba.
Thank you, Job. Yes, Maza, you have the floor.
Great, thank you so much. And everybody has spoken so clearly and eloquently. So I just wanted to reiterate a few points. Glenn, thank you for highlighting those key issues that Joab has also followed up on. And, I think we can all remember when the pandemic started that there were all these articles saying, why is Africa not being hit hard? And it was almost kind of, people were amazed that Africans were not at that time dying in as high numbers as people in North America and Europe. And I think what we saw there was the investment of the work that we had done on other epidemics. So, the community testing, the mobile testing, some of that communication mechanisms for things like hand washing and physical distancing. But as the variants have become more infectious and people have become also quite tired, the pandemic has now been going on for a long time. Here we are still continuing with waves while, as Joab says, people in other countries are reopening their societies. So I think it's important to always remember the things that we have done well while keeping our governments and holding them to account. I just wanted to respond to something Tumiso said about, why do we think people will care about Africa? In this case, we're actually, I think everybody would agree that we're not waiting for charity. We are fighting for justice, and I think the reason why the North Americans and the Europeans have woken up to the fact, at least some of them, that they should care is that this is an airborne mutating disease, right? So even if they close their borders, even a virus like HIV, is much harder to transmit in many ways than COVID-19. Yeah, and I think they've learned that closing their barriers, just vaccinating themselves, even right now, you see countries like Israel who are, world champions, in apartheid and separating people, they vaccinated most of their citizens and they are now moving back to mask mandates and considering lockdowns because of the new variant not being as effective, not being as easily fought by the vaccine. So the efficacy of the vaccine towards the new variant not being as good. So I think that is the lesson learned, and maybe Tumiso, the one reason why those countries might realize that they need to care about what goes on in Africa. We have seen that funding is available. You had Strive Masiwa saying on the news the other day, the money is not an issue. There is money available. So for the first time, we're hearing that there is money available. And I would really encourage all of us to be inspired by what Glenn and Joab have said in terms of using this emergency as an opportunity to change the way going forward, that we can't continue with the status quo, constantly saying that we did not reach the goals that we had set for ourselves. Hopefully this emergency will push us in the right direction. And the last thing I wanted to say was that I completely agree with, Samwely and Thokozile, who pointed out the fact that communication has not been good. And I think that's one thing that all the researchers will agree on, that as they rushed to develop the vaccines, the one thing that they did not do as good a job on was the community engagement side of it. And as Thokozile pointed out, you could have the best medical intervention possible, but if people don't use it, it's not going to do you any good. So I think that's something now that all of us as civil society representatives can work on, is improving the communication. Thokozile pointed out, finding key influential people. Not everybody is on social media. So how do we find the pastor, the traditional leader, the other people in communities that can be convinced and then do the convincing? So that's something that the AVDA community engagement pillar is supposed to be working on. As I said, AVDA has just received a commitment of over $1 billion. Strive Masiwa has said, money is not an issue, there is money. So it's just making sure that we advocate for the money going in the right direction. And as Glenn, Joab, and Buba and others have pointed out, using this as a way, we don't want to go back to normal. We want to develop a new normal, because as Joab has said, this will not be our last pandemic. There are more pandemics coming, and this is our opportunity to finally make a real push for change. Thank you, Buba.
Thank you, Maza. I think we have less than 5 minutes to go. If there is any burning question from anyone, please feel free to take the floor. Julie, you're also welcome as part of the organizers, whether that's something that you want the session to specifically focus on in relation to the RISDP, you also free to take the floor. But over and above that, I think it has been an excellent interaction, very pertinent questions being raised, and very important matters discussed. This is the whole essence of this breakaway session, so that we can bring to the fore, and I hope the communique that has been created, we'll add our recommendations so that the SADC Secretariat and the entire civil society fraternity will also be able to add their voice to the crusade. We need more voices, we need more people to be able to take on the governments and development partners, pharmaceuticals, as well as the communities that we work with, so that together we can be able to stop this virus. We have Tumiso, you want to come on again? Yes, welcome. You have the floor. Or has that been an old hand? Oh, okay. Okay, maybe, yeah. So I think that was an old hand. We just want to emphasize the fact that the People Vaccine Alliance is open. All of you should endeavor to register. The link has been put on the chat by Maza for you to be able to add your signature, and so that weekly or bi-weekly you can join the webinar sessions that we organize to sensitize and raise awareness. We also have a WhatsApp page where we share information around what is happening, who is doing what, and what are some of the current trends that is ongoing. And again, the campaign on the waiver is still on. We are targeting those rich countries that are serving as a bloc. I think for the first time, African countries are united on the waiver. They all endorse the need for Africa and many developing countries to be able to develop their own vaccines, patent-free. So we need to, hammer on into that campaign so that we can be able to get a greater part of our continent vaccinated. So I think we've come to the end of this session. I will be left with no choice but to join it so that we can perhaps join the session, in the afternoon when, right after this, there are other sessions, I guess. Julie will be able to clarify that. But before then, I would like to thank immensely Maza, Sion, and Job Okanda for a great job at such short notice, we are able to mobilize and organize these sessions. So guys, you did it. Thank you so much. I look forward to greater engagements in the region and in the globe to be able to keep the momentum. So thank you also, Julie, for organizing this. Please speak up if you have anything, or else we will all join in the next sessions as the program continues. So don't forget to also look at the communique and add your voice, add your recommendation, so that the development of the communication team will be able to take it on board. So once again, thank you so much. We have barely 2 minutes to go. So I appreciate all your efforts. I appreciate all your time to be with us. So the campaign continues. Aluta continua.
And Buba, thank you. I just wanted to say, Buba reached out and said, we must do a discussion on vaccines. We cannot let this meeting go by without talking about COVID-19 vaccines. So thank you for gathering us together, Buba. I know it was not easy.
Thank you.
Buba. Thank you.
Thank you, Joe. Thank you. I appreciate it. So we can there for the other sessions. Please don't hesitate to join as the conversation continues. There are other pertinent issues that have been discussed in this forum. So please join or share with your partner to be able to join the discussions. Thank you. All right.
Thank you so much. Bye-bye.
Bye-bye.
Thank you, Salome. And thank you everyone for joining. Glenn, appreciate it. We will take on bilateral on some of the issues that have been shared here so that we can, pull our heads together and move on with this crusade. Thank you. Yeah. Okay.
Thank you, everyone. Buba, can I just check with you?
Yes.
Are you going to be the one adding the recommendations to the communique?
We will be doing it together. Let me touch base with my team, but we have
the link.
Yeah, issues to add on to that. So that shouldn't be a problem. We will do that as soon as possible.
Okay, excellent.
Thank you.
Thank you.
All right.